Hi, my name is Shinina.
Hello, Shanine. Come on in and have a seat. So you're applying for a nursing position here.
Yes, that is correct.
So I want to ask you a few questions.
Okay.
What are the areas of nursing that you're most interested in, and why?
The most the areas that I'm most interested in is special care unit, med surge, and ICU. I'm interested in those units because they're fast paced. So I like the fast pace. I love the challenges. So that's what interests me in those units, the most critical units.
Okay. Tell me about your clinical experience. What rotations did you enjoy most, and why?
Surprisingly, I enjoyed the pediatric unit, and the reason why I enjoyed it because I did learn a lot in pediatrics. Other than even though I could get a little bit emotional with working with the peds, but I did learn a lot on the pediatric unit. I also like the telemetry unit as well because that was interesting, and I learned a lot on that unit. And it was also a fast-paced unit.
What is your biggest mistake you ever made, and how was the problem resolved?
The biggest mistake I ever made was I remember early in my career when I had a resident that had fallen and she had hit her head and she started to bleed. So I failed to send the resident out to the ER. So my manager did basically let me know that I should have sent the resident out to the ER a little bit sooner. I did do the assessment, neural assessment, and she did get neural checks as well. But my manager stated that I should have sent her out to the hospital a little bit sooner. The resident was okay, and I just always remember that incident and noted that if that was to ever happen again, that I will send the resident out for precaution measures.
Tell me a little bit about yourself. What do you see as your strengths, and why?
My strength is communication. Of course, we can always work on better communication, so I try to always let my residents know what's going on with them, especially in a hospital setting. The residents are curious of why they're there, how long they're going to be there, their diagnosis, their tests, and that sort of thing. So it's imperative that we let them know what is going on so they're just not sitting there and increase their anxiety levels. So letting them know their tests and making sure that the doctor is following up with them and just being basically an advocate for the resident.
How about your weaknesses, and why?
My weaknesses, I believe, is just caring a little bit too much for my residents. I don't look at my residents as just a patient. I look at them as a family member, as my mother or my father, if this is something going on with them. So I'm always trying to advocate for them, and sometimes I get a little bit too emotional and upset when I see other nurses and, should I say, caregivers, excuse me, who don't provide the care as they should for the residents.
Tell me about a staff nurse who most impressed you, and why.
I had a staff nurse maybe about the third year out of nursing school for me. She was a very good mentor to me. She taught me a lot and she was very knowledgeable. She never got upset when you went to her for questions if you didn't know something, if you weren't sure. Because I'm the type of person, if I don't know something, I'm going to ask you a question because I want to learn. So she was very good with teaching me things and didn't get upset when people came to her to ask her questions.
Okay. How would you most rec- How would your most recent nursing instructor describe your performance in a clinical setting?
My most recent nursing instructor would describe me as being professional, um, demonstrating good communication skills, um, always willing to learn because I am always willing to learn. And she would also say that I would ask her questions as well because I wanted to know what was going on. I wanted to know the reason why things were done with the residents. And also, she was aware that I would want to go in and learn more from the doctors when they would go in and talk to the residents and the patients. I would ask to go into the rooms with them just so I can enhance my knowledge. So she would definitely say that I'm willing to learn good communication skills, and team player because I would help out on the unit as well because it got really, really busy. So I would just help out as much as I could because it was the telemetry unit is as from what I could see, they were a little stressed and overwhelmed. So I tried to help in any aspect that I could and asked her to allow me to do more and show me more things.
Tell me about your most challenging clinical assignment and what you learned from it.
My most challenging clinical assignment,
Yes.
my most challenging clinical assignment um, was working on the pediatric unit. And what the challenge was basically with me working on a pediatric unit. Um, I get a little bit emotional with working with the peds. So when a child came in through a motor vehicle accident and he was vomiting and he just wasn't doing too good at all. He had a fractured nose and that was challenging for me because it actually brought tears to my eyes while we were in the room and just everyone, all the doctors came in the room, all the nurses, everyone that was in that room with that patient when he came in with that motor vehicle accident. Um, he was scared of, him having a head trauma because he did start to vomit. So when all of that was going on, tears came to my eyes. The mom was there, tears came to her eyes, and everybody was just working as fast as they could to make sure that this patient was comfortable.
Okay. What skills do you feel you've gained from your past work experience that may help you in this position?
My assessment skills. During while on the telemetry unit, we did a head to toe assessment skills, and again, she allowed me and she taught me some things, and they had this specific form that they use for their assessment skills, which basically helps you to not miss anything while you're doing the assessment skills on the unit. So that would be a definite skill that I can say that I learned. And again, with communication, it's always good to enhance your communication, and I think that's something that's an ongoing procedure that you can enhance.
So you told me a little bit about yourself. How would others describe you?
Others would describe me as courteous, helpful, kind, compassionate. I'm gonna just look at myself as well as currently I am a manager, so I can be a little stern but fair as well. Um, an advocate for my patients, and just a caring person in general.
What are your future career plans? Where do you expect to be in 2 or 3 years?
My future career plans, my expectations is I'm going right back for my bachelor's. I plan to go back for my bachelor's in January of 2016, and then I plan to go for my master's. After my master's, so that would be my 2 to 3 year time frame, and then after that, I plan to get my nurse practitioner. So within 5 years, I hope to have my nurse practitioner.
Okay. We do not have any openings at the present time in your area. If you have indicated an interest, would you be willing to accept a position in another area?
Of course, I would love to go to any area. Again, if the special care unit is not available, then I will go to ICU or even go to med surge. So yes, I will go to another unit until a unit comes available.
So tell me about a time when you had to establish priorities during one of your clinical experiments.
One time was, again, I can use the pediatric unit. When someone was asking for, well, the parent of a child was asking for pain medication, and with that same person came in for a motor vehicle accident. So the priority was, should we go give the pain medication to the child, or should everyone rush to the child with a motor vehicle accident? Of course, we went to the child with a motor vehicle accident um, because the pain wasn't because the pain wasn't a major issue at that point in conversation. So we basically went to the motor vehicle patient.
Okay. Tell me about a time when you went out your way to assist a family or patient, even though you really didn't have the time.
Okay, I can remember that. On a telemetry unit, we were, like I said, it was a very, very busy unit. Um, and I was on my way to lunch, but one of the patients that we had, she wanted something for pain, she wanted some water, so I went to answer her call light, and I said that, I would sit with her until the nurse had came back because she was just like, I need my pain medicine, so the nurse wasn't around right then, so I sat with her just to try to talk to her and comfort her. I went and got her the water, and we waited for the nurse to bring her back her pain medication at that time, and then she was happy after that.
Okay. Do you have any questions for me?
I do. So, could you tell me a little bit about the facility?
Well, we are an acute care facility. Um, so it could be that fast-paced environment that you visit. But as I said, currently we don't have any openings. But what I'm going to do is we're going to review your application and we'll give you a call.
Could you tell me a little bit about your benefits?
Well,
Do you have 401k tuition reimbursement? Because as I stated, I plan to go back to school to um, get my bachelor's degree and my master's degree in nursing. So do y'all have like tuition reimbursement and benefits such as that?
well, we do have tuition reimbursement. That's after 1 year of employment, and we provide $3,000 reimbursement per year. Um, um, and then the other benefits are usually standard as any other facility would have. You have your sick leave, vacation time, etc.
Okay. Thank you.
You're welcome. You
It
have a
was
great day.
nice meeting you. Thank you for interviewing me.
You're welcome.